The liver meridian has 14 points. There's only a few of them that we're going to be concerned with here. Let's take a look at the pathway of the liver meridian, and perhaps we'll needle a few points as we go along as well. So the liver meridian begins on the big toe. Remember, the spleen meridian also begins on the big toe. The spleen meridian is on the medial corner of the big toe. The liver meridian begins on the lateral corner of the big toe. So this is liver 1, liver 2, liver 3, liver 4, liver 5, 6, 7, 8, liver 9. We come up to liver 10, 11, and 12 in here, then liver 13 and liver 14 ending here. So the liver meridian travels this pathway. The liver meridian is a yin meridian, and yin meridians are generally used to treat internal disorders, and the liver meridian does treat internal disorders, but it also treats pain along the pathway of the meridian. There are some internal connections on the liver meridian that I would like to mention while we're here. The liver meridian, it travels up here and it comes into the groin, as I mentioned before. When it comes into the groin, there's a branch that comes out that encircles the genitals and also enters the reproductive organs. And when the liver meridian ends at liver 14 in the 6th intercostal space on the mid-clavicular line, then it goes internal, it enters the breast. So we use the liver meridian to treat all types of breast problems, any kind of thickening of the breast tissue or sensitivity in the breast or pain in the breast associated with the menstrual cycle. So all breast problems. It also then enters the throat and enters the thyroid in particular. So thyroid disorders are oftentimes associated with the liver. And then it goes internal, encircling the mouth and ending at the eye. So while the liver meridian technically ends on the surface of the body at liver 14, just under the breast, it does continue to enter the breast, enter the throat, and treat the eye. So there's some very important areas of the body that can be treated with the liver meridian. Let's take a look at those few points that are the most important ones for us to consider when needling the liver meridian. So liver 1 is at the lateral corner of the nail. Liver 2 is between the big toe and the second toe, and it's at the margin of the web. And again, needled perpendicular to the skin. It's the fire point of the liver, so it clears heat in the lower warmer and along the liver meridian. Things like herpes or shingles, something like that. Liver 3 is about 1 sun proximal to liver 2. It's just, if we slide our finger up between these two toes, it naturally stops at liver 3. Liver 3 again is the yuan source point of the liver, quite a important point, one of the more important points on the body. Liver 3 is one of the 4 gates, together with large intestine 4. Large intestine 4 and liver 3 are used for pain everywhere and anywhere in the body. Liver 3 is, like large intestine 4, is probably the most moving point on the upper part of the body. Liver 3 is likely the most moving point on the lower part of the body. Liver 4 is just anterior to the medial malleolus. Liver 5 is just above it. Liver 6 and liver 7, all again on the line to liver 8. Liver 8 is just just anterior to kidney 10 in the knee. And these are not uncommonly used points, but not some of the most common points on the liver meridian. When we come up from liver 8, liver 8, liver 9 is just above the knee, and liver 10, 11, and 12 are in the groin area. When needling points in the groin, we must be very careful to guard against, to make sure that we know where the femoral artery is, because we're in that area and we would need to be careful. These also are points that are not commonly used. However, liver 13 and liver 14 are commonly used. Liver 13 is at the free end of the 11th rib, which we can find right here. And liver 13 would be needled, again, once we get up into the area of the ribs, we needle in a transverse or a transverse oblique angle. Liver 13 at the tip of the 11th rib, and liver 14 is in the 6th intercostal space on the mid-clavicular or nipple line right here. And again, liver 14 would be needled again on a transverse oblique angle to avoid any danger of coming too close to the pleural space. Liver 13 is the front move point of the spleen, and liver 14 is the front move point of the liver. So these points are also fairly commonly used. So the big points on the liver are liver 3, liver 2, liver 1, 13, and 14. All right, we'll move on from here.